Children that come to us and that we work with don't talk. They don't have words, or if they do, they're very few words, or they only use them to count or to.
Can they read?
Some kids, several of the children that we're working with right now are learning to read. We're teaching them. We're still kind of breaking it down a little bit more than they might.
I noticed you had a diagram on I think, identifying. Is that presumably for them to recognize what was on it?
Right.
And put a name to it?
Yeah, we use lots of pictures, lots of visuals, schedules.
As teaching tools.
As a teaching tool, because again, because so many of the children don't understand spoken words, using pictures often helps them to better understand that. And what we find, and we use pictures also to teach children to communicate with us. So we will teach them how to take a picture of something they want and give it to us as a way for them to say, I want that, because they don't have the words to say. What you find is two general things. One, children learn to communicate. They learn what communication means. Two is many of those children, well, I wouldn't say many, some of those children begin to talk. And it seems that pairing those pictures, that extra support, doing that in a very consistent way, starts to lead to development of spoken language for some of those children. One of the little boys that is in our school right now, who's probably been there for a good part of the time we've been in place, came in with no words at all. And today, I was at the school for the first time since October today.
How often do you come?
I come about 3 times a year. I'd like to come more.
How long do you stay?
A week to 2 weeks, depending. I mean, I have to. Maybe it's already obvious, but I don't get paid to come here. I donate my time.
I gather all of this is voluntary.
It's all
of this is charity. All of this depends on the largesse of donors.
Right.
Yeah.
So.
And I want the donors who are out there listening to this to pay close attention.
Yeah.
There are a lot of companies in this country that probably have no focus on this.
Yeah.
Have no apprehension of it being actually part of the problem of the country or of our young children. That's why the Rotary Club of Georgetown, in fact, is focusing on it this year, interestingly enough, and I think Rotary is focusing on it internationally.
Mm-hmm.
Which means that it's not an ordinary problem, and clearly if Rotary is giving this much attention to it, then it needs attention.
What we would like to...
Fair to say, we're not giving it anything like enough attention that we ought to in Guyana. Is that a fair statement, Doc?
I think Rotary has a unique role to play.
You're a Rotarian.
Yeah, I'm a past president of the Rotary Club.
Exactly, I forgot to introduce you as that.
But my
I am also a Rotarian.
Yeah, my earnest belief is that this is the kind of real function of Rotary, to shine the light on a problem which may not be able to get attention at the state level because of priorities.
Right.
But it begins to galvanize a constituency out there that starts to look at how we can develop our own indigenous model of addressing this particular issue, and from best practice that might be able to be spread into public care, okay, so that we have the best results which are possible for us.
Can I just say one thing about...
And the private sector obviously should be playing a big role in this.
Can I just say
and
one thing
indeed,
about...
one of your sponsors is coming from the private sector.
Many of our sponsors are coming from the private
sector.
sector.
But a big one.
We have more than one big one. I will not name names because I don't want to. I don't think it's appropriate. But we have more than one big one. And what we want to do is to try to get also into the framework of sustainability. In other words, don't just give us a lump sum.
What are the major costs of running a school like this?
We
apart from the fact that you have to get land and property.
I mean, one of the
Those
issues.
are the capital costs. What are the
capital
operational
costs? But the operational costs run to about 11 million Guyanese dollars a year for our current school. And remember that we are not talking about paying any rent or paying any utilities. Even our donation of the site covers that as well.
You pay the teachers?
We pay the teachers. That is our biggest cost. And if we want the system that Jim uses, they're full-time. The system that Jim uses requires that there be a very low pupil-to-teacher ratio. So if we take on 2 more children, we have to take on another
I would
tutor.
imagine it's almost 1 to 1.
It's 1 to 2.
Yeah, our goal has been to try to maintain that ratio of 1 to 2, specifically given the children who have come to us. Their level of needs are such. If we start to get children with varying needs, that those ratios might change a little bit. But
What about training the parents?
We have
What happens
we
there?
have started there.
yeah, it's one of the basic understandings in all of the research out there on working and supporting individuals with autism is the importance of the parent and the parent role there.
Right.
And so that's a big piece of what we do. We invite parents to come in anytime to shadow, spend time in the school. We always do some
I
trainings.
noticed in the film that
Yeah.
there
Yeah.
were parents
Yeah.
involved.
We always do some training when I'm here, and as Suraiya said, we've been fortunate enough to have a speech-language pathologist, colleague of mine from Boston also, who comes at least twice a year. She's been, phenomenal in terms of being able to help, do a lot of that training, and also to help us kind of move along our work with teaching the children with autism to communicate and helping to teach the parents how to support their child as well.
Step by step.
Exactly.
What gave it that name?
How did we end up with that?
Well,
name? I was sort of brought into it, and it had already had the name when I was brought into it.
Is it something to do with how you deal with the problem?
Yeah.
Absolutely, yeah. I mean, it came from Kay, the mother of the little boy that both kind of brought us, Suraiya and I, together. I think she actually might have gotten it from a school in
the UK.
In the UK.
There is one there, yeah.
But it is. I very much like the idea of step by step, because that's what it is. It's not a come in and get a medicine, your child's going to be better and autism no longer. It's a step by step, slow process, but it shows results that are going to be unique to each individual child.
But it's not curative, is it?
It's not curative. I mean, there are studies out there that have shown that some children do so well with intensive intervention that they don't present with a diagnosis any longer. But in general, autism is considered to be a lifelong disorder.
In your years as a medical practitioner, have you encountered it?
No. And I suspect it's because, well, one, I'm not in the discipline.
Right.
Right, that's not.
But
my
still, you're
area.
HMO.
Well, as CMO, you don't see patients.
CMO, I'm sorry.
Yes, you don't see patients. But I would have done a lot of work at the community level
Right.
at various times. And normally we don't.
Yeah, sure.
ahead.
And I suspect it's because people generally tend to, and this is what we have found in another program, that we're looking for children with physical disabilities. People tend to secrete them at
Yeah.
home.
Well, that's just what I was going to say. Coming to the impact of the
Are parents ashamed of children?
It's
who have
the
autism?
way that society
Is that-
treats
is
them
that
as
a-
well. It is stigmatized. There's no question about it. I mean, one of the reasons we really wanted to have a bus for our children to be transported to school was partly the distance, partly the bus fares and so on. But
You pick
above
them up from their homes?
as many as we can, yes.
That's
We have
tremendous.
children from going all the way up the East Coast and also in the West Coast. So it's not easy, and we may need another bus at some point.
And that's thanks to a generous donor.
That's thanks to a generous donor.
Well,
who
all of it
continues-
is, from what I gather.
continues to pay the driver as well. But
but-
can I just say one thing? That is that they had a hard time, many of them, taking their children on public transport, because there would be comments. People didn't want to take them on the minibuses, and it's hard for them, and so they end up hiding them away, just as you said, right?
But their behavior can be unpredictable, can
They
it
can
not?
indeed.
Yeah.
Yes.
Well, they probably will disturb the bus.
Right.
Yeah.
Mainly.
Yeah.
But I want to say this. There are other examples of Rotary assistance here. The polio rehab, which deals with a lot of physical and
Sure.
they have buses that take their children that come on days,
Right.
stay, go and come. So this is nothing unique. The other thing I want to say is a lot of these newer identifiable issues require intersectoral intervention, which is what we started to talk about
Right.
a little while ago. Just today I was having some discussion with some colleagues, and one of the things we need to have policymakers at the highest level appreciate is that this straight line approach of health, of getting a tablet to solve problems, is not necessarily where we are at anymore in health. People have problems that it's not just medical care that is required, but a lot of other supportive care so that they can have quality of life.
Right.
Okay?
And so at the end of the day, that's what it's
Yeah,
about.
and that's part of the problem sometimes with getting very high level officials to appreciate some of these problems, because if it's not a straight line issue, that is, I can give a tablet or do some surgery or something, nobody's interested. Because this here that Suraiya just described requires a whole heap of intervention. You have to feed these children whilst they're there, because their skills to do that on their own are not as refined as other children of their age group.
Or maybe severely limited.
Or limited, okay? You have to have somebody, if they're not, they're obviously going to have less social skills, so that people have to be able to cope with the fact that they're not, when they're 5, their hygiene is not where it ought to be. Their awareness about hygiene is not where it ought to be. And so somebody's got to help them, and so on. So this requires a lot more applied, the intervention is a lot more applied than straight line care, giving a vaccine or...
Right. And that's why I want to get back to, absolutely right, and I want to get back to step by step. I asked if it was curative. How long do they stay in the school before up to what age?
Well, at the moment, we're just growing with them, as it were. We've been in existence, as I said, since 2011. We haven't kicked out a single child because of age at all.
Well, when are you
for any
no
reasons.
longer a child at school?
It is something we're starting to pay some attention
to. You have
to.
autism for your life.
Yes. Now, at some point, we need to think now, start thinking now and planning now for what these children are going to be able to do if they can do something. Whether there's any skill that we can work on developing. I mean, what we'd like, I mentioned land. We'd love to have some land.
Agriculture?
We'd love to have some land that allows you to grow some fruits and vegetables, for example. That would be great as well. At the moment, we have also no outdoor space, I might add. So there's
Right.
nowhere for the children to go out and play. So this is why we want a good piece of land. But there are other skills that they could get involved with. And as Jim said, we have a child, for example, who's starting to read, doing maths and so on, and doing quite well. We would like a trained teacher to come and work with us to take that forward. When I say teacher, I don't mean somebody who's trained just in how to handle autism, but a regular trained teacher.
Do they get better?
Yes. Yes. And
Yeah.
every
they do.
child gets better in a different way and in a way that's, unique for them. But yes, I mean, as I said, this little boy that I saw this morning was talking up a storm who was not talking before. Children who couldn't play in any way, couldn't use any sorts of toys are now playing. Children who had no way of communicating are now communicating, maybe still in very basic ways, maybe not with using words, but yes, children with autism can make progress. It's just breaking it down and figuring out the way that they learn and meeting them there.
If you have an autistic child, should they come to you?
Yes, we cannot necessarily promise them a place at the moment, but we can certainly arrange for a diagnosis and make some and give them some advice.
How do they find you?
Okay, do you want me to give a phone number?
Yes.
222
222
2633.
2633.
Yes.
222 2623.
No, let's get that right. 222 2633.
Oh.
And I will put them on.
222 36. I'm getting it wrong. All right, let's get this right because it's important. And you asked for
Just
Suraiya.
yeah, I will put them into the system.
222 2633. We have about 2 or 3 minutes. Doc, any last words from you? From a national point of
I
view.
think what we have done here tonight is extremely important. It will alert some parents who have children and need an outlet to contact Suraiya. And I think in the public system, we probably need to begin to think how we can begin to more clearly identify developmental disorders in children. And then, I guess, finally, an organization like hers, when it's narrowed down to autism, can have a role to play, and especially if it proliferates into other geographic areas of the country with some levels of support both at the public and private sector.
Dr. Rudy Cummings, Dr. Suraiya Ismail, Dr. Jim Ellis, I want to thank you very much indeed for this very interesting program. You want to have a last word?
I want to have a last word because I'd like to say thank you to our tutors. They do a remarkable job. Let me assure you, it's not easy what they do.
And I would like to say thank you to you and to all of you who work on bringing these children into a better place, in a better world, and a better Guyana. Thank you very much, listeners, for listening in. Good night.